My name is Yesenia Vasquez, and I'm going to be speaking on my program evaluation titled Don't Be Insane, Implement a SANE Program. SANE stands for Sexual Assault Nurse Examiner. And for those who do not know, April is Sexual Assault Awareness Month. So what better way to discuss such a, you know, great issue, uh, as well as trying to implement a program in hospitals and other rape crisis centers. So with that said, I will start by discussing the social problem. So the social problem being addressed is the problem of sexual assault. Sexual assault is defined as any sexual act that occurs without someone's consent. So that could be penetration, um, forcing you to do sexual acts, penetration, um, and because sexual assault is such an extraordinary, stressful life event, that can leave anyone experience a broad range of overwhelming and confusing emotions. So, and because sexual assault is a crisis, we all handle that in different ways. But I do have a few common reactions that I wanted to include, which would be anxiety, depression, anger, fear. There's guilt and shame, disbelief. Those are a few of um, emotions that a victim experiences during such a traumatic experience. But with that said as well, it affects the population as a whole. It doesn't only affect women. Men are also victims of sexual assault. Inmates, homeless, children, even military members. These are just a few of the social problem statistics that I wanted to provide. So in 2018, there was a study conducted where 321,500 individuals stated that they were victims of sexual assault when they were 12 years or over. 80% of victims of those specific victims were under the age of 30 when that assault happened. 44% are victimized prior to 18 years of age, and college-age students from being between the ages of 18 and 22 are also prone to being victims of sexual assault. Approximately 20 to 25% of college-age women will become a victim of sexual assault or attempted sexual assault, compared to that of 15% of college males. As a whole, 1 in 5 women will become victims of sexual assault compared to 1 in 71 men. So these are pretty alarming. Now to talk about the program description. So here, sexual assault nurse examiners, they are actually registered nurses that have completed a specialized training in conducting forensic exams. That way they act as the immediate medical personnel to care for victims during such a traumatic experience. So in order to become a sexual assault nurse examiner, a registered nurse has to have they have to be an RN. They also have to have 2 years of work experience. They have to complete a 40-hour clinical training and 40 hours of classroom training, as well as pass a state exam in order to receive that certification. Because of this extensive training, they're able to provide a numerous amount of services to victims, which is why I'm aiming to implement this program in rape crisis centers and hospitals so that these victims can get the best care. So one of the services that they do offer are psychological recovery. This is that crisis intervention, that emotional support, that trauma-informed care, that all of that to encompass, to better take care of them, mentally. That way this doesn't leave a great, an even greater psychological impact on them in the future. SANE programs also provide post-rape medical care. This can include prophylactic medication, which is it's a medication that is to ward off STDs and STIs before they reach the body, and as well as emergency contraception. SANE programs also collect, document, and store that forensic evidence. So they'll collect DNA using swabs. They'll collect any clothes or anything that may have been that had been contaminated with the perpetrator's DNA, as well as document any injuries either through pictures or written, and they'll store that forensic evidence secure in like locked coolers that only FDLE and law enforcement will have access to after the exam. SANEs also have the ability to testify in court as an expert witness, and they partner with law enforcement agencies and victim advocates, in the counties to provide post-care to these victims. So for purposes of my program evaluation, my research question is, for victims of sexual assault, does the use of SANE programs compared to non-SANE programs produce greater emotional support and long-term actions within the criminal justice process? So I will touch on exactly what I mean by non-SANE program a little bit later in this presentation. However, just to touch on it briefly, non-SANE programs are those who are just non-sexual assault nurse examiners. So that includes just normal registered nurses, that could be physicians, physician assistants, that kind of medical personnel. So right here is my logic model, and I feel that registered nurses and sexual assault nurse examiners are not the only aspect that we need to make this happen. We need grant funding. We need sexual assault response teams. That's SART. That's actually, law enforcement, specifically those individuals who part of their sex crimes unit. We need them. We need victim advocates from, nearby universities, from the state attorney's office. All of these personnel to work together. That way these victims are getting, adequate care, not only during that forensic exam, but even afterwards. And we do need that medical equipment as well as safe sexual assault forensic exam locations. Of course, I want this program to be in hospitals, but I also want it to be in safe facilities. So if a rape crisis center, has space in their building, or if they own a specific building, that way we can have these confidential locations for these victims to receive the rape kit in where they can feel safe. The outputs ultimately, after providing that empathy, that compassion toward the victim, securing that evidence, and establishing that relationship, I hope that the victims would then feel believed, that they are getting that emotional support they need, that they're feeling cared for. That could then lead to even increased amount of arrests because they're trusting not only the SANE, but they're trusting law enforcement that's in partnership with them to make the best judgment and arrest these perpetrators. My long-term outcomes would hope to aim for victims no longer feeling judged or blamed, victims being engaged in follow-up services such as therapy or counseling. Usually after forensic exam, the SANE will provide a business card or a pamphlet, something that can establish like that outside resource for that victim. That way, once they leave that experience, they're able to contact someone or some kind of agency to get long-term care after this traumatic experience. That would hopefully have long-term psychological improvements and increase amount of successful prosecutions. The hypothesis I have here is, in comparison to non-SANE programs, sexual assault nurse examiner programs will enhance overall psychological effectiveness by providing that emotional support to victims and lead to greater action within the criminal justice process through an increased amount of perpetrator arrests. So right here, I'm going to be discussing the population and sample. Since I am hoping to have my sample taken from the Orlando area, I'm going to start off with the U.S. and those that are affected by sexual assault, and then work my way to speaking specifically about Orlando and my sample. So starting with the upper left corner, you're going to see that approximately 327 million people are in the U.S. alone. Then we just stem down, so going down to Florida now, 21.3 million people in the state of Florida. And the reason I'm being so broad and just encompassing an entire population is because sexual assault doesn't just touch one person. It can honestly affect so many different kinds of people, as I stated previously. So I'm just making it encompassing that whole population. And then, according to a National Intimate Partner Sexual Violence Survey, 17% of women claimed to be sexually assaulted in Florida in 2019, as that would be 1 in 6 women, compared to 20% of men from the state of Florida who said that they were victims of sexual assault. And moving from Florida into now a smaller area, Orlando, that has 2.5 million people that reside here, and all I'm asking for is 100 individuals out of that 2.5 million to be part of my sample. So the targeted characteristics I'm looking for are females, adult females, so those over the age of 18 that have been sexually assaulted within 120 hours. I'm using that 5-day mark because that's when DNA is best for collection, and as well as I would like them to have reported the incident to law enforcement. Um, just for purposes of my dependent variable being the number of arrests, I need to have the report made in order to see the follow-up. So this is my sampling design. So I'm going to be using a single cross-sectional mix method, quantitative and qualitative approach. I think this approach is probably best because the sample cannot be easily obtained. You know, we're never going to be sure when the sexual assault will occur, so I needed to have this kind of method in place. And due to the results, the quantitative will be the number of arrests, and qualitative will be the perceived emotional support of that victim. I'll be discussing that in the slides to come. I'm going to be doing a post-test only group because that would be through a survey. And participants who fit the criteria, as stated previously, will be found at Advent Health, their emergency department in Orlando area, in Orlando, Florida. I chose or Advent Health because it's such a well-known hospital in Orlando, and it also has on-site medication, equipment, space, all of that's needed to help the victims in that moment. You're going to see below as well X1 and X2. So the X's just represent my intervention. So X1 will be the same program, X2 non-same program, and then O is that observation. So then right here, you're going to see my two measures, which are my two independent variables, as I stated before, the SANE program and the non-SANE program. And then my two dependent variables are the quality of emotional support received by victims and the number of arrests of perpetrators. So when I speak of emotional support, I'm mostly talking about that communication between the SANE and the victim. Are they receiving the care that they feel is adequate? Is it an environment that is welcoming, that is open, that is safe? That is the quality that I'm referring to. And then the number of arrests of perpetrators I'm going to be obtaining from law enforcement agencies. So here is a breakdown. As I stated before, I wanted to talk a little bit more about the non-SANE program just to show the comparison and why I think the SANE program will hold more weight compared to a non-SANE program. So for purposes of this program evaluation, out of those 100 individuals who meet that criteria, I want 50 of them to be exposed to the SANE program and 50 to the non-SANE. Participants for both programs will be exposed to the program between 2 and 4 hours. That gives the sexual assault a nurse examiner or the physician to conduct the forensic exam, that rape kit, document any injuries and all of that, as well as have law enforcement conduct their interview and gather any information they need to make an arrest or file that report. So let's start with the SANE program. Once again, they're going to complete a physical assessment of that individual. Then they're going to use swabs to collect the evidence from any penetrated or exposed areas related to the assault. They're going to document genital injuries, written, as well as if they need to through photograph. They're going to provide medication to the victim. So once again, that emergency contraception and prophylaxis. Because they're taught, these SANEs are trained to provide, this emotional support and crisis intervention, they're also there to empower that victim. So they will never give that medication unless they're asking that victim. So if the victim, would like that because that's a fear of theirs, pregnancy or, STIs, then the nurse is happy to give that medication to them. These SANEs are also providing crisis intervention and emotional support during the exam, and they're going to provide referrals to outside agencies once the exam is over. Now, the non-SANE program is just going to perform the physical assessment. They're providing the prophylaxis. They don't tend to give the Plan B. They will usually refer the individual to like a Planned Parenthood or some other emergency contraception area that they can receive that from. So either a drugstore or Planned Parenthood. That doesn't make it necessarily the most accessible to that individual, especially in that moment of crisis. They're going to obviously conduct the forensic exam, they're going to document, and they're going to provide discharge paperwork to the patient. You see, the reason I'm aiming to have this implemented in more areas and in hospitals and rape crisis centers is because right now not every agency or hospital has a SANE on, either on site or on call. So when a victim, either calls law enforcement because they've been assaulted or they show up at the hospital, saying they were assaulted, a physician most likely is conducting this exam. And although it's the same rape kit that the SANEs are doing, they're not trained in all of the to use the techniques to help that victim, feel safe and not re-traumatized compared to the SANEs. So that's why I'm really aiming for this to be implemented at other places. So the way that I'm going to measure perceived emotional support, as I said, was going to be through surveys. I have adopted a survey from the Victim Service Center of Central Florida. They're a rape crisis, the only certified rape crisis center in Orlando, and they also provide free counseling and therapy to victims of crime. So I have adopted their survey because I think it's very helpful. It consists of 8 close-ended statements that focus on the SANE's overall distribution of care. And I'm going to show you on the next slide exactly what that survey is going to look like. They're going to be using a 5-point Likert scale, so that's 1 strongly disagree and 5 strongly agree. The survey is just to target the effectiveness of both interventions. So out of all those individuals, every single one of them is going to receive this survey. The way that I plan to get the survey out to them would be after the forensic exam is conducted, either by the SANE or non-SANE. I'm going to have the social worker that's present at the hospital then go up to that victim and just ask them, request, would you mind being part of this, just evaluating this program. It's for quality assurance purposes. And if they're willing to do so, that social worker will then document their mailing address, and we will be the ones sending out that survey to them. And it's going to have that, it's already going to be stamped so that they can receive the, once they mail it out, they don't have to do anything else. It just pre-stamped, they'll fill it out, and it'll just be easier for them. And I plan to use the surveys 6 months after the forensic exam collection, just because it takes FDLE about 6 months to get the results of the forensic exam to show if there's any, if DNA is present from another individual and things like that. This is the survey I was discussing. So it has statements such as, my nurse examiner was knowledgeable and explained my options to me. So if they strongly agree or they strongly disagree, they can write that. The facility was clean and comfortable, was easy accessible. The nurse examiner treated me with courtesy and respect. So that's all of those things that I find very important to a victim. And I think that just getting these survey responses is going to help just gauge on where they felt more supported from. The next dependent variable and measurable outcome for this program evaluation is measuring the number of arrests. So I plan to gather the records from this 6 months post the exam, and I'm going to request these records from law enforcement agencies in Orlando, Florida. So that would either be like the Winter Park Police Department, or Orlando Police Department, or Orange County Sheriff's Office, those kind of agencies. The purpose behind the 6 months, once again, is due to FDLE's length of time to reveal the results of that forensic exam. And the arrest records will inform me on whether the SANE program produced more action to compare to the non-SANE program. So this is just a little bit about the program evaluation process and the way I'm going to analyze the data. So obviously, these victims will arrive at Advent Health for the forensic exam. The SANE or non-SANE will perform the examination. Hospital social worker will request permission for the survey, as I stated previously, and then I will partner with Advent Health to obtain that information, so then mail out the survey. They'll return the survey, and the survey responses are going to be analyzed using a mode and median approach. This approach is honestly just to see if there's any like commonalities regarding like the quality of care for both interventions, and this helps to determine if the SANEs are working in the way that they're designed to. The arrest data will also be gathered and from Orlando Police Departments, and that's going to be analyzed using a coding process, which will display any parallels between arrests of the perpetrators, the SANE participants, and the non-SANE participants. So this evaluation is intended to emphasize the importance of SANE programs with aims to improve them in all, to implement them in all hospitals and rape crisis centers. However, my approach may not be the best. I did find there are a few limitations. Generalizability, threats to internal validity, and outside variables that affect the dependent variables. So one of those include that I'm only using adult women, and the sample size is that of 100 people. So this may not conclude a valid outcome because I'm not using a number that's encompassing that, the millions of population within Orlando. And I'm also not using a sample criteria that's representing that of society or those who have the potential to be victimized. My threats to internal validity would be like the survey responses. So either the victim not returning the survey because they changed their mind later, or they forget to turn the survey in, or maybe they change mailing addresses to either move somewhere close to family or just to relocate for safety purposes, and now I don't have their new mailing address. So that's another threat. And the number of arrests could potentially be affected as well, because if the DNA turns out to be inconclusive, maybe law enforcement doesn't believe that they need to make an arrest, not necessarily because they don't believe the victim, but because they don't think that they have concrete evidence towards that perpetrator. So that could also affect this program evaluation. One other thing was the perceived emotional support as well. That's another generalizability limitation, because some people will either feel emotionally numb or withdrawn despite who takes their forensic exam. So it may not have anything to do with who's conducting the exam. They just may feel that way, and that's also a limitation that we may come across. So these are just some ways, like future directions, that I feel like to bounce back to those limitations, ways that we can fix that. So when it comes to the sample size, as I stated before, just having a sample size of 100 and then being adult women, I was thinking, we can implement, men into the criteria, or minors into the criteria as well. So even LGBTQ members, those outside of that sample criteria that I stated. That way, it includes a sample that incorporates more of the population. When it comes to the emotional support, or like in the surveys, collecting additional contact information, allowing the patients to pick up the survey, or sending the survey via email where the researcher can only have access to those results, that could be a way to fix that issue. And then I mentioned conducting arrests of accused perpetrators despite all evidence of it. all evidence results, because law enforcement does not necessarily need the DNA to make the arrest. They can use controlled call process. They have, they can use different processes to potentially arrest a perpetrator. So either pulling cameras from a site that they were at, things like that. So I mentioned, just despite the DNA evidence, this could be another step in making sure that these perpetrators are arrested and held accountable for their actions. And overall, I just wanted to mention briefly the benefits of this program evaluation. So that includes to determine the effectiveness of SANE programs compared to non-SANE programs. The research will impact social work practice by advocating for sexual assault victims. And overall, this evaluation is just intended to implement the SANE program at all hospitals and road crisis centers, not just some, because this will impact greater reports made to law enforcement and victims ultimately feeling believed and having that emotional support by the SANEs. So, and these are my references. Thank you so much for your time, and I really hope you enjoy.